In recent weeks, President Trump noted mild swelling in his lower legs. In keeping with routine medical care and out of an abundance of caution, this concern was thoroughly evaluated by the White House medical unit. The president underwent a comprehensive examination, including diagnostic vascular studies. Bilateral lower extremity venous Doppler ultrasounds were performed and revealed chronic venous insufficiency, a benign and common condition, particularly in individuals over the age of 70.
U.S. President Donald Trump has been diagnosed with chronic venous insufficiency after leg swelling and visible bruises on his hand sparked widespread speculation. The White House says the condition is benign and common, especially in older adults, like President Trump, who is 79 years old. White House Press Secretary Caroline Leavitt read a letter from Trump's physician, confirming the president's cardiac function, kidneys, and overall tests were normal. There's also no sign of deep vein thrombosis or arterial disease, which would have raised more serious concerns. The bruises on Trump's hand? Leavitt said they're from frequent handshaking and aspirin use, part of his cardiovascular health routine.
Importantly, there was no evidence of deep vein thrombosis or arterial disease. Laboratory testing included a complete blood count, comprehensive metabolic panel, coagulation profile, D-dimer, B-type natriuretic peptide, and cardiac biomarkers. All results were within normal limits. An echocardiogram was also performed and confirmed normal cardiac structure and function. No signs of heart failure, renal impairment, or systemic illness were identified. Additionally, recent photos of the president have shown minor bruising on the back of his hand. This is consistent with minor soft tissue irritation from frequent handshaking and the use of aspirin, which is taken as part of a standard cardiovascular prevention regimen. This is a well-known and benign side effect of aspirin therapy. And the president remains in excellent health, which I think all of you witness on a daily basis here.
But what exactly is chronic venous insufficiency, or CVI? CVI occurs when leg veins can't return blood properly to the heart. Blood collects, or pools, in the legs, leading to swelling, heaviness, or even pain. It's more common with age and in people with risk factors, like obesity, prolonged sitting or standing, and family history. The symptoms: swollen ankles, cramping, heaviness, itching, varicose veins, and in severe cases, skin ulcers. Treatment begins with simple steps, like walking regularly, wearing compression stockings, and keeping legs elevated. More advanced treatments include sclerotherapy, laser ablation, and even vein surgery in severe cases. Despite the diagnosis, the White House says President Trump remains in good health, with no signs of systemic illness or functional limitations. Trump's age was a key talking point in his 2024 campaign, where he targeted Joe Biden's health and mental fitness. Biden later dropped out under party pressure. Kamala Harris took over the Democratic ticket, but lost to Trump months later. So while the president's leg swelling drew attention, the diagnosis isn't alarming and his condition is manageable. For more updates on President Trump, U.S. politics, and global developments, subscribe to the Indian Express YouTube channel now, and hit the bell icon so you never miss a beat.